Hi, my name is Dr. Carlos Burnett, and I'm a board-certified plastic surgeon in Westfield, New Jersey, and I'd like to talk to you today about ethnic rhinoplasty. Now, many times people say ethnic rhinoplasty. What they're referring to is rhinoplasty on a nose that is, or a nose job on a patient that is not of Caucasian descent. For example, an African American rhinoplasty, an Asian rhinoplasty, a Middle Eastern rhinoplasty, those are all considered ethnic rhinoplasties. And as a plastic surgeon who specializes in this particular area, I believe that we have to be aware of the different distinctions between the different types of noses. And what that entails is just knowing the anatomy generally and what you see as the characteristic in each ethnic group and what they're trying to preserve or enhance. When we do rhinoplasties, the patient's goals are the most important thing. And I think that when we think about these goals, we speak to our patients and first and foremost, we ask them, how's your breathing? Because we'd like to know if the patient has any airway obstruction or any problems with their breathing that can limit their exercise tolerance, that can affect just the way they interact, that can even affect their voice or how they may sound. We want to find out exactly what characteristics they'd like to change about their nose. So I like to break it down by looking at the nose and starting from the top and working our way down. So we generally look at the patient's skin, get an idea of how their skin relates to their face, and then looking at the top of the nose and working our way down, we ask them if they're satisfied with the bridge, with the middle portion of the nose, with the tip of the nose, and with the width of the nose. So those are the basic things that patients have issues with. Sometimes, for example, you'll see some ethnic groups will say that my nostrils flare too much. So that particular patient may need a reduction of the ala. We call it an alar reduction. Alar base resection is another term utilized for that. A patient may say that I've got a big bump on the top of my nose. That bump we can reduce, so we do a reduction rhinoplasty. And all these techniques I particularly like to perform in an open manner. The open technique is utilized for access to the cartilage and the underlying structures of the nose. It allows the plastic surgeon an opportunity to see the exact anatomy or deformity that a patient may have. And by doing that, we're able to pretty much get an idea of where we need to go with that particular surgery. So, for example, if a patient does say they have a bump on their nose, we know that we can do that reduction rhinoplasty, which will help us to make the tip of the bridge of the nose more refined. Sometimes we need to use cartilage to build up that area of the nose if it's deficient. So that's in another ethnic group. You'll see that often in Asian patients where they have a deficiency as opposed to a bump here. It's just a bit recessed, and by it being recessed, we need to augment that area. So an augmentation rhinoplasty is done in that particular circumstance. Your surgeon should be familiar with the different types of noses and the different maneuvers so that he can try to achieve your goals. And that's what's important about this particular surgery. You and your surgeon should be on the same page. You should try to articulate as best as you can exactly what your expectations are. Bringing in goal photos, I think, is a very good thing as well. But no surgeon will ever promise you the same nose of the picture that you happen to bring in. That's because our anatomy is different, but similarities in noses can be achieved. So those are some of the things that I find particularly important in ethnic rhinoplasty. I often get a question about and this was a question that was sent to me recently, will my nose job change my ethnic appearance? So that's a very interesting question. And I think that the true or good ethnic rhinoplasty surgeon can guarantee that it will not change your ethnic appearance, and it will just enhance your appearance. That being said, the plastic surgeon has to recognize those characteristics that are appealing in your particular ethnic group that you may be trying to emulate. So, ethnic balance is a term that I've coined that relates to giving the patient a refinement to their nose as well as enhancement of their nose, but not detracting from their ethnic features. So I think that's a very important point to discuss.